All right, so we have here a model representing the human heart. So the base of the heart is superior. The apex of the heart would be inferior. Let's start with the right side of the heart. So on the right side of the heart, we have the right and left brachiocephalic veins feeding deoxygenated blood to the superior vena cava. Here we have the inferior vena cava at the inferior aspect. This is the area of the right atrium. As we open this up, we can view the pectinate muscle. By the way, this is also the right auricle, this region right here. As we look in the right atrium, we have the ostium for the coronary sinus, which drains deoxygenated blood from the heart muscle itself to the right atrium, as well as the fossa ovalis present within the right atrium. Now, the blood will pass from the right atrium into the right ventricle. And here we can view the trabecular carni muscle. And here we have the tricuspid valve with its chordae tendineae anchored to the right ventricle via the papillary muscle. Okay? Here you're seeing then the blood from the right ventricle will exit via the pulmonary valve or the pulmonic semilunar valve, enter into the pulmonary trunk, go to the lungs via the pulmonary arteries, okay? And then we will have blood entering into the left atrium via, here we have the pulmonary veins and pulmonary veins, bringing oxygenated blood to the left side of the heart. So here we have the left auricle. Here we have pectinate muscle in the atrium, trabecular carni present within the left ventricle. Here we have the mitral valve, aka the bicuspid valve. Here we have the chordae tendineae, the papillary muscle anchor the chordae tendineae. Right. We also have here the interventricular septum. And then you'll notice that deep within here, we have the aortic valve. The aortic valve will take oxygenated blood through the ascending aorta, the aortic arch, and then this would be the descending aorta, aka the thoracic aorta, taking oxygenated blood to the systemic circulation. Some other points of notation here we have as far as this would be the ligamentum arteriosum, as well as the fossa ovalis are remnants of fetal circulation. We have here, this would be the brachiocephalic trunk, brachiocephalic artery, also known as. We have here the, this would be the left common carotid artery and the left subclavian artery. They're cut. You can see that they're cut. Right? And let's see, as far as then coronary circulation is concerned. So with coronary circulation, we have the right and the left coronary arteries. You can see right here, it's only this piece because the left coronary artery is deep to this pulmonary trunk. Okay? And then you'll see here as far as this would be the interventricular, the anterior interventricular artery in red. Okay? And then we have the circumflex artery here. And then also, let's see here, as far as the cardiac veins are concerned. So with cardiac veins, we have here the great cardiac vein, the small cardiac vein, and the middle cardiac vein, bringing deoxygenated blood to the coronary sinus, and the coronary sinus will take that deoxygenated blood from the heart muscle to the right atrium via the ostium for the coronary sinus. Very good.